This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. It's an absolutely beautiful, beautiful day outside, providing you only are aware of the sunshine. Forget about it being cold and just look at the sun, and you'll feel all better. Wait and take your phone calls at 888-630-9625. That's 888-630-9625. It's one of those days today that, you can really delude yourself into making believe that it's spring. Just, stay inside, look outside, look at the sun, actually wrap up and go for a walk. It's really a pretty day outside. A little bit of wind, but if you keep warm, you'll really enjoy the day. In studio today, somebody that's near and dear to all of your hearts, somebody who I admire and have for many years, and a guy who's an expert in the subject that we're going to be talking about, one that affects so many of you. You get out and it's this time of the year. You should be out playing tennis. You should be playing golf, running around, starting to stretch, starting to do those things that you've been putting off all winter long because, it's too cold to go out. Sorry about today. But you hurt, and, you get up slowly because your knees hurt, or you get up slowly because your hips hurt. You walk upstairs, and you can't make it as easily as that you should. So we're going to talk about hip and knee pain and the functional problems that arise because of them, but more importantly, where they're coming from, why they occur in the first place, and then subsequently, when you understand why behind something, you can put a fix to it. You can really resolve a problem if you do it right. And who other than the dear Dr. Harlan Browning. Welcome, my friend.
Thank you, Tom. Always good to be here.
It's one of those things that you see on a regular basis, and unfortunately we see way too many people with this type of problem, and people put up with it, or they take every drug in the world to try to deal with it so they can numb it up, and if they don't feel it, they don't exist, except they start giving up life. They stop giving up the things that they would like to do, love to do, the distractions that make life sane. But when it comes to your hips and your knees, if you don't have the capacity to move, you don't have capacity to live. So let's talk a little bit about that. And in the society, I'm just kind of a general question because I don't even think our listeners are aware of how prevalent this is. But in society generally, when it comes to knee problems and hip problems or the combination thereof, how far-reaching is that net?
I think it's extremely far-reaching. We find that we live a relatively stationary lifestyle nowadays. We sit a lot. We spend time watching TV and all those things, and unfortunately, they're not the best things for our joints, and it causes slow decay. And most of the folks that we see are in this downward spiral that's inching along over time, and they get to a place to they can't do the things they want to do, and it's not acceptable.
There's an interesting conversation that's out there today, and it's called sitting today is the new smoking. And people don't get up, and it's ruining their lives. But one of the things that we do see is this inability, because if you don't use it, you lose it type of syndrome. You're sitting in front of computers, you're on your instruments, you're doing all those things. You go from house to car to the shopping center, you're back into your car. We don't walk, we don't. It's a catch-22, of efficiency, but nevertheless, it's breaking us down as who we are as human beings. Let's talk a little bit about the manifestation of problems that begin to present themselves. We know that hip problems can lead into knee problems can lead into hip problems, but what do you see, if you had to name several things that are the triggering mechanisms that lead to predispose people to having hip pain or knee pain, what would they be?
I'd probably say that the two big things are injuries in the past that have never been addressed or rehabilitated. So, the body will compensate over time. It will heal, but sometimes the quality of tissue that it heals with is not great. So it sets us up for failure. The joints start to break down because the integrity of the cartilage becomes compromised. And I think the other one, probably the most prevalent one, is we just develop a lot of muscle imbalance because of what we do for a living, or the way that we carry ourselves. So certain muscle groups will become weaker over time, certain muscle groups will become tighter over time, and then you get this tug of war match, and then your knee or your hip is caught in the middle, and unfortunately the soft tissues in there, the cartilage, they'll break down. They can't handle that.
We see patients on a day-to-day basis in the practice that have multidimensional presentations, and in my experience over the years, hip and knee problems are just that. They're a multidimensional cascade of problems that lead to the symptom of hip pain or knee pain. And you can go from above down, or you can go from down up, and either one is going to rock the boat. So, but let's talk about the muscle functions. Every joint in the body has a muscle that it's related to, okay? And so in the case of the hip and the knee, there's many muscles. It's not just one or two. There's support muscles from the back, there's support muscles from the front, and they allow the hip and knee to move. Interestingly, these muscles will cover, in these two situations, two joint spaces. They have mechanical distribution to both. So you have what we commonly refer to as the thigh muscle, the anterior or the front muscle, and it's a quadricep muscle. It means four muscles. But that muscle has a lot of interventions, and it has a lot of guys that work with it in as an orchestration, if you will. So we have this muscle that crosses over the hip and again crosses over the knee. So it's a multidimensional mechanism of action. How does that muscle weaken or dysfunction, causing, setting up, and how do people not know it's happening?
Well, the most common reason is just people are sedentary, and over time their leg muscles get weaker because they're just not using them. In many cases, though, it can happen because of the nerves in the low back are becoming compressed or irritated ongoingly. So if the nerve to that muscle is irritated, then the muscle doesn't get the information it needs, and then it'll slowly atrophy over time. And then as it atrophies, we walk differently. Then again, the joint becomes a part of the bigger picture.
Here's an opportunity. This Wednesday evening, April the 1st, well, it's April already, 7:30 p.m. at the Roselle Center for Healing. Dr. Harlan Browning will be your host, your presenter, and he's going to talk about hip and knee pain. Wouldn't it be great to have a summer, a spring, a fall, to be able to get out and do the things that you want to do, without jeopardy, without worrying about doing something worse that's already there? You're already on tons of medications, and the medications are minimally alleviating the discomfort, but it's not covering up the cause. This is an opportunity for you really to find out what the triggering mechanisms, but more importantly, what you can do cooperatively, but what you can do on your own to make a difference. I want you to give us a call at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to be there. We do require a reservation. The presentation's a gift. It's to you. It's no cost whatsoever. We want you to be well. We want you to be able to do the things that you want to do in life, and here's a great opportunity with a master practitioner, somebody who really understands it. This is his gig. This is what he does. He loves sports injuries. He loves joint space problems. You really will learn everything that you need to know about how to turn these around. 703-698-7117. And how you reach us today here in studio, 888-630-9625. That's 888-630-9625. We talked a little bit about above-down. We talked about the nerves in the back affecting the muscles of the leg. And obviously, if the muscles aren't facilitated, working the way they're supposed to work, then the mechanism of action isn't going to be supportive. And now you have something that's predisposed to injury. But just to touch upon, what happens from the bottom up?
Well, a big cause very often for people who have knee problems and certainly also hip problems is they have dysfunction in their feet. Either the foot is really flat, we call that pronation, or maybe they're walking on the outside of the foot, we call that supination. But regardless, as the foot mechanics changes, then we have to adapt a strategy upstream. So we're going to hold the knee differently, we're going to hold the hip differently, and as time goes by, if those joints aren't properly aligned, then they're going to start to get inflamed, they'll break down, and certainly they'll cause a lot of pain.
So it's a domino effect.
Yeah, it's a domino effect. And then, what happens is as we're favoring one side, then we start to shift the weight to the other side. So it's not uncommon that a person starts having right hip pain, and then 2 or 3 years later, now we've got also left hip pain or knee pain.
Let's kind of dissect this a little bit, because so many patients walk in and they've been previously diagnosed. Their doc has told them X. They've been to an orthopedist, they've been someplace, and they come in with this sheet of medications from steroids to anti-inflammatories. There's a term that we hear in sports all the time, but we hear it in general population. It's called hip pointer. Doc says, I have a hip pointer. What does that mean? Well,
a hip pointer in athletics usually means that the person has fallen on the side of their leg and hit there's a protuberance, a big kind of outcropping of the bone called the trochanter, and it's pretty sensitive, and there's a fluid-filled sac that sits on top of a bursa. So if we hit that, then we're going to damage that tissue. Sometimes that bursa will swell up. That's bursitis. But for a lot of folks, I think the term hip pointer is just a word that a lot of the doctors use to describe, lateral hip pain.
So it's not always specifically diagnostic. It's often just a symptomatic, well, it must be this.
Yeah, and really to be a true hip pointer, the person has to have some sort of contusion. They have to be tackled or fall on that hip. But certainly that hip pain pattern, be it because of the bursa or there's a membrane that sits on top of our muscles called the iliotibial band that gets tight and gets adhesions. Those will cause a lot of pain patterns as well.
So a hip pointer, if it is a contusion, if it's from an impact injury of some sort, in definition, you have an inflammatory reaction of that synovial membrane, the bursa, and it's trying to act as a buffer, if you will, and if it's treated properly, and that's all that there's left, it should be resolved in a relatively short period of time.
It definitely should. Most of the time it doesn't resolve because, again, I talked about that iliotibial band, that membrane that's on top of it, very often is just chronically too tight, so it's always putting pressure down onto that bursa, so there's always underlying inflammation going on, and then you have the trauma, and that kind of gets the ball rolling, and sometimes it's an on-again, off-again thing for years before a person even thinks about doing it.
So, Dr. Harlan, that brings up a point. You said too tight. So you got a band, and when we talk about the iliotibial band, it's also called the tensor fascia, a lot of this long muscle band type of thing that starts in the hip and inserts all the way down to the side of the knee. And it actually has input in both joint spaces, the knee and the hip. So are muscles too tight or are muscles too weak? Is that muscle tight because something happened to it directly, or is it too tight because there's something opposing it that is not balanced properly?
It could be too tight as a protective mechanism. The body will kind of splint things, but very often it's too tight because the opposing muscle group has gotten weaker over time. In the body and in neurology, we have this competing system that's going on that means that as one muscle group contracts, its opposing group has to relax to make things move smoothly. But sometimes what happens is muscle groups will just become tighter and tighter and shorter over time. And reflexively, the muscles that do the opposing action just kind of become damper and don't work as well. So it sets us up again for a lot of instability, and ultimately the joint takes the brunt of it.
This Wednesday evening, the Roselle Center for Healing is going to present hip and knee pain problems, and we'd love to have you as our guest at our office. Dr. Browning will be your presenter, your host, and all you got to do is to be there is to call us, 703-698-7117. That's 703-698-7117, and tell my staff that you're coming and who's coming, and we will confirm with you because we have only so much space. As some of you found out a couple of weeks ago, we had to tell you, I'm sorry, we don't have any more room. Call now, call early, and make sure that you reserve that. And remember, these classes are for you. They're all about giving you the opportunity to help and fix yourself so you can enjoy your life the way you're meant to enjoy it. And unfortunately, so many of you don't have that opportunity. We're coming up to a short break, and then we're going to start taking your calls. We're here at 888-630-9625. That's 888-630-9625. My guest today, your host this Wednesday evening, Dr. Harlan Browning. Many of you have heard him speak over the years, know that he's the real deal. He has the capacity to really get into the problem, fix it properly, get you back into the world, in your life, do it the right way. This is Dr. Tom Roselle. Don't go away.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Hey, welcome back, everybody. It's a beautiful day outside, providing that you're bundled up and warm. But at least the sun's shining, and enjoy that. Let that melt into your body and realize that the sadness, SAD, seasonal affective disorder, has gone away. It's getting to be that time of the year where at least you can feel good. Might have to stay a little warmer for a while, but yeah, you're going to feel pretty good. 888-630-9625. 888-630-9625. That's how you find us here in studio. My guest today, your host this Wednesday evening, the 1st of April, 7:30 p.m. at the Roselle Center for Healing, Dr. Harlan Browning. The professor, we're going to be talking about hip and knee pain, the guy that really knows what those mechanisms are all about and how to fix it. So if you're suffering with any kind of problem like that, show up. Here's an opportunity for you. Let's go to the phones. Anna, thank you for holding and being patient. How can I help you?
Yes, I would like to ask a couple of questions, primarily related to ligament pain, which seems to have stemmed from an overuse injury due to snow shoveling some years back, and at this point it has intensified, and it seems to travel to different areas or to different joints in the body, excuse me, in particular upper arms and the hip area. And I was just curious as to how one could alleviate that. When I seem to take anti-inflammatory omega-3s and flaxseed oil, it seems to bring it a little bit into a realm of less pain, but it does return, and it seems to travel to different joints.
Okay, let's see.
My muscles also feel tight.
Let's see if we can open the path for you on this thing and make it better for your life. Go ahead, Dr. Browning.
Yeah, hi Anna, it's Dr. Browning. If the pain is migratory, in other words, it's going from joint to joint, then I suspect the problem isn't with your ligaments per se, but it sounds like you might have some sort of chronic inflammation going on that's just causing the joint spaces to be irritated. So I suspect it's not the ligament, but it is the inflammation that's irritating the ligaments.
When I move my joints, with minor exceptions such as, let's say, in my thumb, but let's say if I move my hips by swaying back and forth or backwards and forwards, I don't feel any pain, and I don't feel pain upon lifting of the arms either, other than just a little bit below the shoulder, right where it seems that muscle or ligament seems to attach. But I would agree with you that it seems to be getting chronic, and I would like to see if there is a way to address that.
Oh, there's certainly different ways to address it. The first important thing to do is to figure out exactly where it's coming from. When we have migratory pain, I almost always will look in centrally towards the spine. Sometimes we have chronic nerve compression that will cause pain to be referred distally. So that would be certainly in my diagnostic hat. Blood work to see if there's any inflammatory situations going on as well.
I've had some blood work done, and it had ruled that out, but the physician who was trying to determine as to my regular primary physician who was trying to determine as to what the problem might be.
And Anna, let me ask you a real quick question. It's Dr. Tom. Do you drink coffee?
I drink a lot of tea, yes.
Okay. How much water do you drink?
About 5 or so cups a day. Okay,
what I'd like you to try is, we can help you. There's a lot that we can do. Matter of fact, this class would be very, very important for you this Wednesday evening.
Yes.
Dr. Browning would have the opportunity to sit and talk to you. But here's what you need to do. Try to get rid of your coffee completely. Slow down a little bit, only because coffee is acidic. And if you have a chronic inflammation, acidity increases the inflammation in the body. It makes it worse. And
okay.
so if you try that, and then my mantra, I'm just going to give you a mantra. I'll try to do it slowly. Sugar, sodas, coffee, black teas, fast food, fried foods, alcohol, gluten, additives, preservatives, things that are not supportive. They're non-food items. They're very acidic in themselves, will make matters much worse. So if those things are in your life, you need to shift them. The other thing is increase your water intake and make sure that your water at least is neutral at 7 or alkaline. And what you want to do is drink a cup of water every hour that you're awake for about 7 hours of the day, 8 hours of the day. See if the combination of those things help you somewhat. And again, we're here to help you. I think Dr. Browning could really shed the light on this thing for you.
Okay.
And I appreciate it. Thank you for your call. I'd love to see you this Wednesday evening. Diana, how can we help you? Thank you for calling.
Thank you. I have edema in my legs and a lot of problems with my knee as the cartilage is worn down. I'm 86 years old. I also have colitis. Now, I saw a product in the drugstore, hyaluronic acid, and I'm wondering if the fluid there would help my knee at all or irritate any other part of my body with the colitis.
Well, certainly anytime someone has colitis, which is an inflammatory gut condition, it can be hard to break down vitamins and minerals and certainly to absorb them. Hyaluronic acid is a lubricating fluid that's in all of our joints. So in some cases it can help people. Usually when we have degeneration of the joint itself, the best bet is to put in those nutrients to stabilize the cartilage before you think about revitalizing the lubricant, so to speak. But if there's some sort of process in place that's causing the cartilage to break down, in other words, maybe the alignment of the leg bones or the foot, then that has to be addressed sooner than later.
If that's not taken care of, then nothing that you do will make a difference. It's like, if you have a foundation in a house that's shifted and your second floor window is broken because of that shift, you try to fix the second floor window without fixing the foundation, the window's going to break again. So you have to go after the reason why that takes place. And again, going back to the things we're talking about biochemically, if your intestinal system can't absorb the hyaluronic acid or any of the other things that we would use to rebuild, then it doesn't make any difference. It's just putting good money after bad, and it just continues to cascade in a downward basis. So, but you have to look at structure first. You have to look at neurology first. Then you look at the chemistry. These are things, Diana, that can help and can make a huge difference. Can get rid of this thing. Give us a call, and if you have the opportunity to attend the class this Wednesday evening. We're going to take one more real quick, although we're coming up real close. Sylvia, how can we help you?
Oh, hi, yes. I have pain that's continuing that started quite a few weeks ago from the shoulder down to the elbow. Don't know whether it's muscle or bone, and I know I have osteoporosis. Is there some way to stop the pain, and if it's a nerve pain in particular?
Well, Sylvia, that certainly does sound like a nerve that's getting compressed or pinched, probably in the lower part of your neck, or sometimes it can actually get compressed in the arm itself. You have to identify where it's coming from. Is it because there's degeneration, arthritis, or maybe even a disc issue?
Sylvia, I'm going to hold you over. We'll answer just a little bit more. We're coming up to a break, and we have to be respectful for our time frames. Hold on. You're listening to Dr. Tom Roselle Live.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.
Are you thinking of selling your home? Well, it's Larry O'Connor with great news for you. Why list your home with an ordinary real estate agent when you can have one of the top real estate teams in the area, according to the Wall Street Journal? Call my friends Sarah and Debbie Reynolds of the Reynolds team with Keller Williams. Sarah and Debbie have developed exclusive consumer programs that are simply not offered by other agents. Their time frame for selling homes is legendary, 3 times faster than the average agent, and they also get their clients 5% more money. Listen, Debbie just just sold a home on Fair Valley Drive in a weekend. She received multiple offers and it closed in 2 weeks. It had been listed with another agent for months. Sarah and Debbie are so confident your home will sell, they'll guarantee it in writing. If your home doesn't sell, they'll buy it for a price acceptable to you. That's right. Call the only agents I would trust to sell my home, Sarah and Debbie Reynolds, at 844-344-SOLD. That's 844-344-SOLD, or go to DebbieHasTheBuyers.com. That's DebbieHasTheBuyers.com.
1-877 Cards for Kids. KARS Cards for Kids. 1-877 Cards for Kids. Donate your card today.
1-877 Cars for Kids. KARS Cars for Kids. 1-877 Cars for Kids. Donate your car today.
To learn more about our programs and to donate, go to cardsforkids.com. That's cards with a K. Pickup is quick and easy. You'll also get a vacation voucher and maximum tax deduction.
1-877 Cars for Kids. KARS Cars for Kids. 1-877 Cars for Kids. Donate your car today.
Also accepting boats, motorcycles, RVs, and real estate donations. Did you know that breast cancer is on the rise and that routine annual mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? The result could increase the risk of developing breast cancer. Now, consider a simple, non-invasive, and totally safe adjunct medical procedure approved by the FDA, which can detect evidence of breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect initial signs of breast cancer, such as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call Thermography Centers at 888-485-7736. That's 888-485-7736. And for more information, visit thermographycenters.com.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and include a thermographic breast scan as part of your annual wellness checkup.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. 888-630-9625. That's 888-630-9625. That's how you find us here in studio. If you'd like to find us when we're not in the studio, go to rosellecare.com. That's ROSELLECARE.com. Send us a note. We'll get back to you. I promise you that. One of my docs will call you. We'll get an email out to you, but we do respond. Guest in studio, your presenter this Wednesday evening, the master, the professor, Dr. Harlan Browning. We're going to be talking about hip and knee pain and why you can't function the way you want to function. Go upstairs, go downstairs, play tennis, golf. You really need to take the cart around the course because you can't swing your hips too badly. You put off, you're off the ski slopes. You're doing all kinds of things that you used to not have to do to put up with life. Well, here's an opportunity to fix it this Wednesday evening, 7:30 p.m. at the Roselle Center for Healing in Fairfax. We're just off the National Capital Beltway, Route 50, probably about a third of a mile, in the Red Cross building. Join us. Love to have you, but we do need a reservation, so give us a call. Let's get back to Sylvia. Sylvia, still there?
Oh, yes, I was going to mention that I was told I have an arthritis in the spine, and I probably have, the irritation, etc. And all I was given was a cervical collar. Is there more than one can do? Because my arm hurts when I move it now.
Yeah, well, the cervical collar, all that'll do is prevent you from moving your neck, and unfortunately, it'll also accelerate the degeneration arthritis. What you need to do is to have that nerve decompressed, and spinal manipulation and different forms of traction to do that quite effectively and pretty quickly as well.
So Sylvia, what happens is that, if you have something that hurts and you don't move it, the chances are that it's not going to hurt a lot if it's a joint. But it doesn't answer the question why it's hurting to begin with, because as soon as you take the collar off and you start moving it, the damage is already there, and you're going to start getting irritation. So if the nerve that's going into the muscles of the shoulder, if the nerves that are coming from your neck that go into your hands and your forearms are pinched, are irritated, then you're going to have symptoms that are going to be produced. So, the old saying, if, you don't use it, you lose it. So if you don't use a joint space, it furthers and accelerates the degenerative change. But you also have a catch-22, because if you have something that's damaged and it's not in proper alignment, if the muscles aren't firing the way they're supposed to, and you push against that, it's going to be worse. So what you have to do is you have to fix the alignment, you have to strengthen the muscles, you have to fix the inflammatory triggering mechanisms, the building blocks, if you will, the cement that's in there. So so to answer your question, is there more that can be done? Yes, a tremendous amount of things that can be done. And, we'd love to have you as our guest this Wednesday evening. Come on by, talk to Dr. Browning. He'll give you some insights. But, yes, so much more can be done. Sylvia, really appreciate your phone call. Don, how can we help you, sir? Thank you for being online.
Hey, how you doing, sir?
Good, my friend. What's going on with you?
Well, I had 11 months ago a broken neck and a crushed spinal cord. They had to go in because I was being paralyzed from the neck down. I had surgery. They fused C3, 4, and 5 and put a metal plate in my neck. Since then, my neurologist told me it was one of the best in the country, and I believe him, but I don't see much happening. My fingertips are very numb. I'm still extremely numb, unfeeling from my waist down to my toes. Occasionally I have very sharp pain, muscular pain, and I don't know how to describe it any other way. And I fall a lot, which caused a lot of problems with my knees. I really don't know how to explain it. Am I going to have to wait 18 months to 36 months to hopefully get back to normal?
No, Don.
If I get back to normal at all.
Don, let me intervene here just a little bit. Unfortunate set of circumstances that took place in your life. And Dr. Browning, feel free to jump in on this. And I'm going to tell you a little story. And years ago, there was a young girl that I treated the entire family. At the time, she was about 13 years old. And she was in a sledding accident down in off of Route 1, and she went down the hill. She was out with her brother and her sister-in-law, and they were sledding, and she went down, and she never came back up. So they went down, and they found her laying next to the tree. And what had happened is she went headlong into the tree and broke her neck. And she was paralyzed, quadriplegic on the site. So they took her into the, obviously took her in the hospital. Father called me about 3 o'clock in the morning telling me what had taken place. And so they told her she would never, ever walk again. She'd never use her hands again and so forth. And I began to tell the father, I said, there's other ways. And I had him do certain things while she was in the hospital, stimulating reflexes in the feet, putting a couple homeopathic drops in her mouth. And within 2 weeks, she started moving her feet, and she started moving her hand. And the short end of the long story is that today, basically 20 years later, she is functional, she's capable, she has a right contracture of the right arm, but everything else is working the way it was supposed to. She has a bit of a step gait, meaning she's unstable on her feet, but she's up from what they told her with some of the best people in this area that she would always be paralyzed. She would always be dependent on somebody else in her life. Today she's married, she has full capacity, she's able to do whatever she wants to do with the limitation of that right contracture in her arm. So what I'm saying to you is that even though that you probably have technically a phenomenal surgeon, and a lot of these guys are really good, the thing of it is that's what's missing. There's other pieces that can be stimulated and evoked response. See, because cervical 3 to 5 that are fused on you, below that, there's other segments that are going to be involved. Further up, there's the brain and spinal cord. We know that if we facilitate stimulation of the brain and the upper portion of the cord, it can have a profound effect all the way through. And the spine has multiple mirror images of other pieces of the body itself. So things can be made better.
Does vitamin B6 and B12 help aid the nerve growing back together?
Hi, Don. It's Dr. Browning here. B6 will help in certain nerve entrapments, carpal tunnel and those types of things. But a lot of what you're describing, it sounds like the spinal cord shock. In other words, the spinal cord itself was traumatized, and it unfortunately it takes time to heal. When you fuse those segments too, then you've lost mobility, so that can often complicate it.
Don, years ago there was a study that was done by a group of neurosurgeons in Boston, and the founder of our specialty, Dr. George Goodhart, and they were dealing with patients who were paralyzed, and they found that in any kind of spinal trauma that evoked either a partial paralysis or a full paralysis of the body, there was a buildup of something called arachidonic acid within the spinal cord, and they used very specific supplementations to help begin to break down this buildup within the cord that was stopping the neurological transmission. What they found was it wasn't that the cord was severed in any way, but the nerves were being blocked because of this interruption in signal by this arachidonic buildup. And with stimulation at different receptors, they found that people would begin to see blood flow increases, then they would see motor function increase. And in many cases, they began to see dramatic shifting and not full resolution necessary, but movement in the paralysis. And what we found is that to be true over a period of time. We know that acupuncture and low-energy light laser and specific nutrients that are, and for some people have to be in combinations, others independent, but there's no one-size-fit-all. There's no broad-based brush that says do this. But things like vitamin B1 and taurine and low dosages of vitamin E and high levels of omega-3, 6, and 9 fatty acids, and I mean very high levels. If you're going to take B12, it has to be something that breaks down inflammatory properties. So there's things that can be done, but they have to be done very, very specifically and long-term in combination, in conjunction with things. So, Don, listen, here's the deal. You're out of Laurel, Maryland. I would love to have the opportunity, and Dr. Browning would have the opportunity just to speak with you, to give you, because over the air, I don't want to give you a broad brush. I don't know enough about you. I don't know enough about the condition. But I do know from clinical experience over 38 years that much more can be done, particularly with the things that are available for us today. You can give us a call or, show up this Wednesday evening. We will take the time to speak with you and to see if we can put a little bit more light into this. Marty, Houston, Texas. Wow, thank you for giving us a call. How can I help you?
Hey, hi. I had my gallbladder taken out probably 15 years ago, and I was interested in taking the omega-3 fish oil, and I wondered if this was appropriate for me.
Omega-3 fatty acids that are oil suspensions for you will be difficult in processing. Dr. Browning.
Yeah, you might want to think about taking a digestive aid, something to help break down the fats, something that incorporates something referred to as lipase. That's an enzyme that helps you break down fats, and a little bile salts. That's what our gallbladder stores. It's actually a salt. It works like a detergent, so it breaks down fat, emulsifies it, and puts it into little tiny droplets. So most of the patients that I see that have had the gallbladder out, they do better on an enzyme, regardless of the fact that a lot of times they don't have any digestive complaints.
The thing of it is, Marty, is that the gallbladder is there for a reason. It's a vesicle that holds bile. And then when you put fats in and other things, the gallbladder and the pancreas work together to squeeze their components in to break everything down. But you continue to produce the bile. You just have no place to hold it now. So it's constantly being leaked into the intestinal tract. So the truth of it is, and most physicians won't tell you this because they don't understand it, is that now you're going to have to take digestive enzymes with your meals for the rest of your life. You're going to need the bile salts. You're going to need the enzymes that Dr. Browning was talking about, and to help make you whole again. Unfortunately, God didn't put spare parts in that you could take them out without consequence. They're there for a reason. And even though that it took care of the immediate situation, the inflammatory reaction, the congestion, and so forth, you still have to support that. So yes, there's lots that can be done to help you. I wouldn't use, unless you're going to take high levels of bile salts, and then you can take the fatty acids and oil suspension. But there's other things. There are dry forms of omega-3s that you can take if you have a practitioner. Matter of fact, do this. Send me a note, and I will look up in the Houston area. There are some good docs down there that do the kind of work that I can respect, and I'll send you a referral. Just go to rosellecare.com, send us a note, and I will get back to you with 2-3 people in that area that do nutritional protocols that can make a difference for you and help you along.
Okay, well, that sounds great. Thank you very much.
I appreciate it. Marty, thank you for calling. I get tickled. I'm flattered. You know, we have people listening to us from Houston, Texas, from Arizona, from Hawaii. Dr. Tom Roselle Live is getting out there.
It's spreading, that's for sure.
It's an amazement to me, but I'm very, very humbled and very grateful for the attention and the ability, the privilege to being able to help as many people as we possibly can, because that's what we do.
You know what? I think that the beauty of it is there's a lot more informed and educated people now. I'm a lot of times just blown away by the amount of nutritional knowledge a lot of times people have when they come to the office. So, I applaud those folks, do the research, look at the literature, try things on yourself. And, a lot of times you can fix your problems.
Well, we sit here, the book, and I wrote it a couple of years ago for our patients, Ageless Health, Health is a Do-It-Yourself program, and then the movie Ageless Health. And by the way, for those of you that have never seen the PBS TV special, the twice Emmy-nominated award special, join us on the 19th of April, and you'll be able to see Dr. Browning live in center. He's part of the program. We're going to be there answering questions for you. It's a very, very heavy-hitting day. We'll introduce the program. We'll talk about the 6 patients that are involved, and I'll answer all your questions afterwards. A great opportunity to be intimate with your specific problems, but also see how integrative mechanisms work. But again, we're very excited that we're reaching so many people, and that's why we do what we do. Ageless Health, Health is a Do-It-Yourself program. As Dr. Browning said, you are the captain of your own ship. You have the capacity to turn things around. And as I've encouraged you many times, don't believe anything that you hear, read, or see just because somebody said it, including us. What we want to do is evoke a response. We want to provoke you to do your own homework. We want you to get out there and really do the study to help yourself. You control your life. You're the one that needs to turn things around. This Wednesday evening, Dr. Harlan Browning will be your host, your presenter at the Roselle Center for Healing. He's going to be talking about hip and knee pain. Love to have you there. Really would love to have you there. And we'll take some time for you, talk about your problems. All you need to do is call us at 703-698-7117, 703-698-7117. And remember that this is a gift. This is our way of helping you. We do not charge for these presentations, but we do require a reservation. Dr. Browning, let's talk just a little bit about that hip and knee problem again. So many patients say, well, I'm going to have my cartilage, redone in the knee. I have medial pain. Is it always necessary?
No, it's not always necessary. If you address the problem early on. Now, if a person gets to be bone on bone, then it becomes a very difficult situation to resurrect that knee. And I see a lot of people that just assume that knee pain or hip pain is not a big deal, and then they finally get around to investigating it, and they get an X-ray, and then the hip joint or the knee joint has been obliterated. So less options at that point. There's still certainly things that we can do to make it better. So the take-home message is, investigate as soon as you can before the damage is done.
Quick question for you. NSAIDs, non-steroidal anti-inflammatories, everything from aspirin to Motrin to so forth, good or bad for joints?
Over the long haul, it's horrible for the joints because it starves them of sulfur, and sulfur is the rich nutrient that makes up the basement part of our foundation. It's part of all the cells. So if we don't have sulfur, we can't build strong tissue.
Yeah, it's one of those things people don't get. Well, it doesn't hurt if I take whatever. What the problem is your knee's getting worse, your shoulder's getting worse, your hip is getting worse. It's actually going into a rapid downward spiral of destruction and degenerative osteoarthritis, and now you're stuck with a replacement part, which is going to make somebody very happy in their mortgage payment. Don't go away. This is Dr. Tom Roselle. We'll be right back.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. In studio, my guest today, Dr. Harlan Browning, your host, your presenter. The professor is going to be talking to you about hip and knee pain, something that, coming into the summer, you want to make sure you can get rid of so you can do what you need to do. Some of you have had problems because of all the snow and ice we've had this year. You went out there and you tried to pick that stuff up and shovel it around and sweep it around, on top of a problem that may have already existed, and now it flared its ugly head, and you seem to be stuck, and you're in the mode of taking all these wonderful anti-painkillers and anti-inflammatories, and things get progressively worse. But there is an outcome. There is a way of resolving this, and that's what we're going to do this Wednesday evening at the Roselle Center for Healing in Fairfax. We're just off the National Capital Beltway in the Red Cross Building. Give us a call at 703-698-7117. That's 703-698-7117. Tell my staff you would like to reserve a seat, and that's all that's required is a reservation, because it is our gift to you, to the community, always. And you'll have the opportunity to ask some very direct questions and perhaps turn some things around. Bill, thank you for calling. Appreciate it. How can I help you, sir?
Hi, Doctor. I definitely plan to be there on Wednesday, but I had one small problem that's been bothering me for a month now. I wake up in the morning and my head is clear, everything's fine, but then it seems like my nose or my inner ear starts to block up, and I have to try to equalize the pressure. Like when you're in an airplane. And as the day goes on, it gets worse and worse. Is there some easy way I can do it? I mean, I hold my nose and I blow, and that gives me a little bit of relief for a minute or two. But is there something that I should do, some little quirk that I can do to fix it?
Well, Bill's Dr. Browning, I think what you need to do is figure out what you're allergic to. There's something you have a sensitivity to, environmental sensitivity in your house, and what's happening is you're building up fluid, and just so happens in your case that the fluid's building up in your ear, and then it's going to change the way you hear, and certainly can cause wax formation. So the first thing I would do is look at what you're allergic to.
But I don't get any discharge. There isn't any fluid buildup that I can tell.
You won't have that, Bill, with an allergy reaction. Unfortunately, so many of us think that an allergy is we're going to see fluids, or we're going to be really badly plugged up, or we're going, that kind of stuff, sneezing and coughing and the like. Allergies can cause pain. They can cause inflammation. They can cause, in your ear, you have this little tube called the eustachian tube. It's a drainage tube from the inside of the ear.
Yeah, years ago they operated on mine when I was a kid, because there was something wrong with it. I don't remember what it is anymore.
Do you eat a lot of dairy products, cheese and milk and things of that nature?
A glass of milk a day with cereal.
Okay, you willing to try something? Do three things. For a period of 30 days, stop anything that is dairy, stop anything that has gluten in it, and stop anything that is other than a natural sugar. You can have some berry.
How do I know what has gluten in it?
Gluten is wheat. It's oats and wheat and rye and barley. If you stay away from just those things, you can look it up online. Just go gluten foods, and it'll give you a list of certain things, and then just look at the package. If you eliminate those things, I have a suspicion just doing those three things, and if you do them 100% for 30 days, that at the end of the 30 days you're going to see a significant shift, and then there's other things that can be done. Ask us this Wednesday evening. Come to the class, and we'll give you some more information on that. But, Bill, that's where you start. I agree with Dr. Browning. Based on what you're reporting, it's an allergic response of some sort. And, unfortunately, in our culture, we're trained to think that allergy reactions are things that we breathe in our environment, things that we absorb through our skin and so forth. But they can be subtle. They can be food substances that are not overpowering, but just enough that over chronic periods of time begin to cause us degradation. So give us a call, Bill. We're happy to help you with that. Dr. Browning, we have a couple minutes left. Let's talk about the class Wednesday evening and the kind of things that you're going to be covering.
Well, we're going to go through a lot of the why behind, certainly, hip and knee problems. I'm going to certainly talk a lot about things that mimic hip and knee problems. So, very often when a person comes in and they describe something as a hip problem, it's actually a low back or sacroiliac issue. So we're going to talk about those things that maybe seem like a hip problem but are actually something else. We'll look at quick fixes, ways that you can handle it at home, and certainly things you can do from a strategy standpoint to prevent it from coming back.
I have a and probably not a fair question, but I'm going to ask you anyway. In your opinion, what do you think is the most life-type presentation that begins to trigger these types of conditions? What is, and we see it mostly, other than athletes and identifiable situations of that nature, we begin to see them as we get older. Why is it so age-related when we have these hip and knee problems?
Well, as we get older, we don't have the reparative mechanism that we once had. So, the things that we do to our body start to accumulate. Typically, as we get older, we don't take as good care of ourselves. We don't do those things that we need to. We don't exercise. We don't stretch. We don't stay hydrated. So we get to a break even, and then all of a sudden we have a problem that doesn't go away.
We just can't hang in there anymore.
Nope.
The deal is done. The deal is not done, because no matter where you are in your life, you can begin to turn things around. You just have to know how to do it. It's not okay to stay in pain. This Wednesday evening, you'll have that opportunity. Give us a call. Love to see you there. You're listening to Dr. Tom Roselle live right here, same time, same old place, every Sunday at 12 p.m. See you next week.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Attend Hip and Knee Pain with Dr. Harlan Browning on Wednesday, April 1st at 7:30 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.